this bill seeks to ensure that we are fully aware of any additional costs that may ultimately result in higher premiums. To do this, we first define a health benefit mandate as a regulation impacting a health benefit plan or the state health plan that meets one of the 6 requirements as described in subsection A1. Then the bill requires that if any new bill falls under this definition of a health benefit mandate, the bill shall also include at least one provision that repeals at least the same number of health benefit mandates that are already in effect. This will ensure that we're not imposing additional burdens on the health system. I have a list here of the 58 government health insurance mandates, and be happy to send this to anybody that would like it. So if you're considering filing a bill to create a new one, please refer to this list to find one you would suggest that we eliminate. Lastly, the bill requires that any new bill also include an appropriation of recurring funds in the amount of that cost to the cost of the mandate to the state health plan or any other relevant state agency. If the state is going to mandate that our employers, namely our small businesses, cover certain medications, treatments, or therapies, the state should be willing to do the same on our own balance sheet. Therefore, new mandates on employers, or that 25% of the market that these mandate bills usually target, in order to be considered by the Senate, shall also apply to the state health plan and carry the appropriation to cover that with state dollars. Part 2 of the bill, this portion of the bill requires any provision of Chapter 58 containing a health benefit mandate shall also apply to the state health plan. The reason for this is to ensure that any new cost that is applied to North Carolina health care is also applied fairly to the state health plan. Committee, we know that lowering health care costs must be a priority. We believe this bill is a first step in ensuring that we are aware of exactly what we are imposing on the healthcare system to be sure we are working towards the goal of making healthcare more affordable for our individuals, families, and employers. We just heard this in healthcare at 12 o'clock. We had, I think, 69 people that showed up to participate. I can't remember how many speakers we had. All the folks that got up supported it. The treasurer's folks got up and supported it, and it passed unanimously. And Mr. Chair, I'll be happy to answer any questions.
Any questions from the committee? Yes, sir. Senator Everett.
Thank you. I was wondering, has there been any studies? I understand that the ranking that North Carolina currently is in. Has there been any studies showing that it is because of mandates that we are in the position that we're in?
Thank you, Mr. Chairman. Senator Everett, it's good to see you.
Good to see you, sir.
Sir, I don't have anything that says this particular mandate causes this, but I go to healthcare meetings all over the country, and when I look at the top 5 states, we're number 1. Texas and Florida are on there too. But then when I look at our outcomes, we're 30th. And then I look at states like, and I use Massachusetts a lot because I've talked to people from there. They're one of the lowest healthcare costs in Massachusetts, but they're one of the top 5 in outcomes. So, I want to know why. And as I look, what's different about North Carolina? And I told the other group, I want us to be first in everything except this. This is not a good thing for us to be first with. And I think it's an economic detriment to our state, because if I was an employer and I was looking to bring 1,000 jobs to North Carolina, one of the things I'm going to look at is what's it going to cost me, because those employees are going to be my number 1 expense. And when you add that we are the highest in the country, which means we're the highest in the world. Think about that. We are not only the highest in our country, but the U.S. is the highest healthcare cost in the world, which means we are the highest in the world for healthcare cost, and that's not acceptable. So I hope what this bill is, and I'm going to brag on Senator Newton. He's not only a dear friend, he's a mentor and advisor and everything else, but we've been talking about how these kind of things need to be applied to a lot of things, where we actually make sure we count the cost before we do anything, but especially in healthcare. I don't know if that answered the question, but I want us to move on this and be dealing with it pretty quickly.
No, thank you.
Sir. Mr. Chair.
Senator Corbett.
Thank you, Mr. Chair. Thank you, Senator Bergen, for bringing this. I support this bill. As you know, I work in the health insurance industry, working this a lot, and I've seen over the years how mandates do increase costs. I think we all understand that when the Affordable Care Act came out. And mandates aren't bad. Let's be clear, all mandates are not bad. I think they're well intentioned. But when there is a mandate, it almost always increases costs. And I think this bill is simply about transparency and about reporting. And so, Mr. Chair, with that, I would, at the appropriate time, make a motion for a favorable report and referral to rules.
All right. Any other questions of the committee? All right, at this time, we'll open it up to public comment, and we have a couple of speakers on one line, Amy Auth and Tim Friedman, State Health Plan. If one or both of y'all would like to speak, we'll give you 2 minutes.
Thank you, Mr. Chairman, members of the committee, and Senator Berger. My name is Amy Auth. I just wanted to, I know many of you, I wanted to reintroduce myself. I have recently moved over to the new Treasurer's Office, the Department of State Treasurer. I've got Tom Friedman, who is our Executive Administrator of the State Health Plan, here with me today, as well as Colin Russell, who is our Legislative Liaison. So thank you all for having us. Senator Bergen, thank you for introducing the bill. We wanted to let you know that the State Treasurer and the State Health Plan are in support, and I'd love to turn the mic over to Mr. Friedman to explain that in greater detail.
Thank you, Amy, and thank you, members of the committee. The state health plan right now is going through some resetting. We have a $500 million deficit to close this year with an additional $800 million next year. So this bill gives us greater predictability and understanding and letting the staff and the board handle solving those deficits and those challenges in front of us without introducing new unfunded mandates and administrative difficulties. So we're very grateful for being included how we are in the bill. And just thank you all. And if there's any questions, be more than happy to answer them.
Thank you. We also have Aldous Watkins signed up to speak.
Thank you, Mr. Chairman and members of the committee. And Senator Bergen, hello again. We were just upstairs on this same bill. As he said, I do need to apologize to Senator Bergen before we get going good here, because Scenic does not support this bill in so much as thinking it's done. My remarks earlier today said that we support any efforts towards transparency and improving our situation so we're not the worst in the nation in terms of cost and third from the bottom in terms of outcomes. We think people deserve infinitely better than this state and this country are giving them with regard to health care, and we think it can be done. What we would need to see in a bill like this, if we're going to talk about transparency and mandates, right now the mandate is we must keep secret from the public what we are spending with taxpayer dollars on this health plan. That's 135-4810 in the North Carolina General Statutes. It mandates secrecy. That is crazy to me. Taxpayer dollars, public dollars for public employees, and the public doesn't have a right to know, but somebody that's working in Onslow County in a $40,000 a year state job, we're going to publish their salary, and that's fair and square because it's public money. But it is beyond me why these massive public contracts with public money aren't being done that way. As for Massachusetts, Senator Bergen, I think they are onto the right track. January 1st of this year, a law went into effect, an act promoting a resilient healthcare system that puts patients first. It requires providers to say how much the care would be. Thank you, sir. And it also fines a provider $2,500 for every instance of non-compliance. We would love to see something like that put in this bill, and then we could cheerlead. And we want to cheerlead, Senator Bergen, because we love you. Thanks so much, very much for letting us speak.
Yes, sir, Senator Bergen.
Mr. Chair, I hope that was recorded. Can
We
somebody
love it.
put that on a loop that Scenic said that?
I'll put it on t-shirt if you put it in the bill.
Thank you. Further comments or questions from the committee? Yes, sir, Senator Everett.
Thank you. I'm going to vote for this to come out of committee. I have concerns. I have concerns that I don't think there's any study that indicates that this is a way to lower costs. I don't think that this bill in and of itself does anything to lower costs. It only is activated if there's another mandate down the road. And I have concerns that this will lead to eliminating contraceptive coverage, or in the state health plan, a woman who's raped having access to coverage for an abortion. I worry about what's down the road with this. But I am open to see, further discussions, and to have my mind changed, to see that there is a study out there that shows that this is a good idea and it leads to better costs for North Carolinians. Thank you.
Thank you. Senator Bergen?
Thank you, Senator Everett. I ran the bill that allowed pharmacies to dispense hormonal contraceptives without people having to go to the doctor. I run a number of healthcare bills to try to make sure that we do. I'll be happy to sit down with you and cover any of these things, and I'd love to listen to your ideas. As I tell everybody, a bill as it goes through, until we vote on it on the floor, it can always be made better. So would you please reach out to me and let's sit down and talk. Thank you, sir.
Other comments or questions from the committee? If not, the motion is from Senator Corbin for a favorable report of Senate Bill 24 with a referral to Rules and Operations of the Senate. All in favor say aye. Aye. All opposed, no. The ayes have it, and that is the end of today's meeting.